Just double click on that. Double click on it, see what happens. Did you click on it? Would you shut up? I have to admit you first. Wet. Okay, Jeannie, you're unmuted, I hope.
I am, I believe.
Yes, you are. We have a few people so far.
Mm-hmm. Let's see. Maggie, I love it that you're sitting on top of the world again.
Yeah, I put this up when I didn't want everybody to see my bedroom, when I had the computer in the bedroom, and now I haven't figured out how to change it. So
Oh,
I know there's something down here to change, but
mm-hmm.
you're supposed to rename me. You still have real books?
I do, in fact. I always joke about decorating with books, right? I had a friend who decided that he didn't want his books anymore. So he got a Kindle. And I'm like, how do you decorate your house with a Kindle?
Right. Well, in all the Zoom meetings we watch, you get to see how what people are reading and what they project on
Hmm.
their backgrounds. You just flipped all your hair up.
Oh, sorry.
We don't care.
Uh, we're all friends here, right?
Yeah, right. This is Zoom.
Did I see that the schools are going to be remote again all of a sudden?
Uh, the high school is because they have a COVID case.
Oh, mm. Who was it? Was it a teacher, a student?
They never tell you.
Oh, okay.
Like, I didn't see who they said. They have a problem of getting substitutes. And
Right.
they have a staff member. We usually give people a couple minutes even after 7:30. So,
Mhm. Yeah, that makes sense.
can you see the list of names?
I can, yeah. Uh-huh.
I don't know if you
I
recognize
see,
people.
yeah,
No,
I see Pam Little. Hi, Pam. How are you?
I've got them all on mute.
Oh, okay.
How are you?
Good, thanks. How are you?
Pretty good.
I'm trying to keep everybody on mute, even Pam. That way we don't get dogs barking.
I'm wondering if my cat is going to come join us. He likes Zoom. Remember when we were doing our test run, Maggie? He came up. He likes to get up here. He doesn't have Zoom fatigue yet. So he gets up here and he stares into the camera, or else he poses in front of the camera.
Okay, I guess I can admit people even after we get started. Um, I'm Maggie Klein. I'm welcoming everyone to this Zoom meeting sponsored by the Manor Club. The Manor Club is closed right now. We welcome male and female members, and we are having a series of Zoom meetings. Coming up will be on the 22nd. Paul Friedman will be discussing what is American cuisine. And on March 1st, we will have Kathy O'Callahan discussing welcoming refugees to Westchester County. And we tonight have Jeanne Pinder, who's going to speak on healthcare and how we can save money.
Oh, what'd you do?
Maggie, are you okay?
Yeah, go ahead.
She just fell.
Go ahead.
I'll get her.
Okay. Apparently I cannot share my screen right now. It says host disabled participant screen
Okay.
share.
Get me up.
Use the chair. Hand up.
Don't step on my glasses. Now go to the, see where it says share.
It says share. I'm sorry. This share.
The green, share.
Oh, green share screen.
Yeah. Do that.
You hit the button. What now?
No,
That's what happens when I just share screen.
no. Hit it more again. Oh, God. Hit me.
Get up.
Okay.
Use the chair to lean on. Get your glasses up. I can't pick you up.
Hold it.
Try to help.
God, help me. I can't.
Get yourself over the chair and lift. Now put your feet down.
It's not.
Well, hold on. Walk over to the window. So there's a brace.
Hi, it's Ursula Huff, also a Manor Club member, friend of Maggie's. Why don't we help her out a little bit and move on? If she's not talking, if she's quiet, our speaker can just be the person on the screen. So go ahead and say something and let's see if it works.
Yeah, I can
There you go.
start talking.
Okay,
Okay. I do have a PowerPoint, but I don't actually need the PowerPoint for right now. So we'll
Hang on.
uh-huh.
Here I am.
Oh, Maggie.
Good, Maggie, good.
Maggie, you're amazing.
Pardon me?
I said, Maggie, you're amazing.
Poor thing.
I'm trying to share it.
Oh, wait a minute now, I got lost. Jesus Christ, what is this? Ah.
Oh, what happened to it?
meeting and we'll get you up.
Where's my
What do you need?
glasses?
I picked them up. They're right there. You're gonna sit there all. Why? I would get on your feet first. You're out of the meeting. Get it. Get it.
There we go.
Oh, perfect. Okay.
Can you share now?
I cannot yet.
I don't know why it won't let you share.
Yeah, it still says host disabled participant screen sharing. So I think if you click on the share screen button, there are some options next to it for you.
I did. There it is. There it is.
Okay, I've got a share screen option then.
Sorry.
No, no, are you okay, Maggie? I'm worried about you.
No, I'm okay.
Okay,
Let's start the meeting over again though, so it can be recorded.
okay.
This is Manor Club's Zoom meeting. Clear health costs, Zoom meeting. Go ahead.
Oh, thank you so much. Thank you, Maggie, for having me. That was heroic what you just did. I hope you're okay. I want to thank everybody for coming, including people I know and people that I don't know. I see Pam and Peggy and some other people. So Maggie asked me to talk about how to save money on healthcare. I thought I would start out by telling a little bit about the company that I run and about who I am, and then we'll get into the actual nuts and bolts about how to save money on healthcare. So it's called Clear Health Costs. Those are my whereabouts there. You can always, all of you, email me or call me any time of the day or night. The problem that we're wrestling with is that nobody knows what stuff costs in healthcare. Like, we all think that we're paying too much, and maybe we are. Our solution to this is actually telling people real healthcare prices. So these are real prices from our reporting. That MRI could be $300 or it could be $13,000. A blood test could be $19 or it could be $522. So what we're doing is helping people ask questions and navigate effectively in this very confusing marketplace. Before I go any further, I should say Maggie and I know each other because we're both journalists. I was at the New York Times for almost 25 years. I volunteered for a buyout in the class of 2009 without any real clear idea of what I wanted to do. A year to the day later, I won a Shark Tank type pitch contest for $20,000 in New York City in front of a jury of venture capitalists and internet bigwigs who thought that I could build a company telling people what stuff costs in healthcare. This was at the City University of New York Graduate School of Journalism. I entered a class and a contest without ever really thinking that I could actually do this. And when I won the money, I was shocked. I almost gave the money back because at the beginning of 2011, I realized how hard it was going to be. And then I won another grant for $20,000. So I had $40,000 worth of no strings attached seed money, which, as we all know, is not really enough to start a company and certainly not enough to make a dent in this enormous healthcare system that we all are fully aware it likes things just the way it is. That healthcare system doesn't want to change. They don't want transparency. But as journalists, what we do is we love finding stuff out and telling people about it. So we set out on this journey to try to figure out how to do this, and also looking for a business model because they needed to find some way to make money, right? You can't just live on grants. So what we did was we invented over the course of time this way of collecting information and displaying information and writing about it and helping people understand how to get around the healthcare system, how to navigate, how to negotiate, how to find their way in this very confusing system. This is interactive software that we built. I didn't know anything about building software when we started out, and I had to learn how to build software. This is actually a pretty cool interactive software that lives on our websites and the websites of our partners. What it does, it lets you share your prices and search prices so that you can actually have some visibility into things like how much does that blood test cost? How much does that MRI cost? How does it work? On the left-hand side, you can contribute your prices. So let's say you wanted to tell us about your recent MRI. You type in MRI, you get this pull-down menu. So I'm going to pick lower back without contrast. What are these numbers, you ask? Well, here we're going to explain that to you. These procedure codes are used to run the billing system in healthcare. And if you want to read more, you can click here. Who's your provider? So if you type in a few letters, then you'll get this pull-down menu that's powered by the Google Places API so that we have clean data, right? Where did you pay for it without insurance, or do you have insurance? Type in a few words, a few letters, and you get another pull down menu. Where did you get your insurance? Employer, healthcare.gov, Medicare, Medicaid, or other. What was the date of your procedure? We're trying to make it really easy for you to tell us information. What was the total price charged? What did insurance pay? What did you pay? How did you feel about it? Big old comment box here. How did you feel about it? Tell us stuff. Give us your email if you want to. We won't make that public, but we might want to reach back to you because we're journalists and ask you some more questions, ask you to go on camera. Give us your phone number, same thing. We won't make that public. Send us your paperwork, like your explanation of benefits or your bill. Please feel free to black out details like your social security number. We won't make that public. Tell us you're not a robot. Agree to our terms of service, acknowledging that you're making your information public. And when you click here, share what you paid, you're in our database. What do the results look like? So let's say you were looking for an ultrasound. I happen to know this data set. I kind of like it. It's from New Orleans, one of our partnerships down there. So within 50 miles of 70145 zip code. So how we do this is we start out by surveying doctors, hospitals, clinics, and labs on their prices. We call them, we have a survey methodology. Anything that we collect is in orange. It's the base color of the app. And it has this little flag up here that says price check journalist, right? If they won't tell us, then we out them. No prices over the phone, because that's data too. Like you would want to know that if you were going to East Jefferson. Anything in blue came in from the left-hand side, like where our community members are sharing their information. Orange, that's one of ours. In green, we have providers coming to us and saying, we'd like to put our data in your database. Like, how do we do that? So we give them a spreadsheet, they fill it out, and then we upload it. And they come in as healthcare provider, they're in green. So this is one of ours, 150. That same ultrasound, right? It has that same CPT code. Here's a community member for $150 at East Jefferson. Notice, I've had my ultrasounds done at EJ for over 23 years. My insurance changed. I have a $3,000 out of pocket. So I paid cash to have my ultrasound done at EJ. So this for us is a story. We can write a story about how when people put away their insurance card and pay cash, they get a lower price. So we're doing this not only to make a database that's searchable, but also to do great journalism. This is one of ours, 166.81, 170 at Auctioner. Specialty doctors require a $500 self-paid deposit at check-in, which means no poor people need apply, right? So even if that procedure is only $170, you still have to pay $500 to get in the door. That's a story. 190, here's 200. This company, Diagnostic Imaging Services, wants us to know that they will let this cash price be used for uninsured people or for people who don't want to use their insurance. So like the woman that we saw before, sometimes you put away your insurance card and pay cash. Not every provider will let you do that, but what they're doing here is signaling, yeah, we're okay with that. So that's a story for us too. 235, 295, same thing that other people are getting for 125, right? 649, 865. Look at that. She was charged 865. She paid 865. And she said when she had the procedure done, she paid in full upfront. Then she received a balance due of $87. I called North Oaks about the balance due. No one was able to help me. They sent my bill to collection, so I paid it. What else can you do? Same thing that other people are getting for 125. Also, what does Medicare pay here? 120.96. We had to teach the software to figure this out. And then why would you care? Well, what Medicare pays for this procedure in this area is the closest thing to a fixed or benchmark price. So Medicare has prices for every CPT code in every locale. The same ultrasound in Manhattan costs much more than it costs in Des Moines. So this is customized for your locale. We'll give you the Medicare price so that you can have this sort of 360-degree view of pricing. 1,006, same ultrasound. And one of my personal favorites, the $2,926 ultrasound. So what we do with this information is we're building the searchable database that people can then use. They can contribute their information and search also. And then we take that data and we make great journalism out of it. So for example, this is just basically how it's done. We do the pricing survey. We use government data for that benchmarking thing. Interactive software on our partners' websites, allowing community to both share and search. And then we call people to come and contribute. Here's some of the journalism that we did. This was in New Orleans. The woman in the upper left-hand corner went to a doctor with a sore shoulder. She came out with a diagnosis of frozen shoulder and a bill for $160, which seemed steep but fair because it was a specialist. And then the clinic followed up with a facility fee bill for $1,434.01. Because the clinic that she went to was part of the Tulane Medical Center empire, she had no idea. She wasn't anywhere near the university, but she got this bill that was almost 10 times what her original bill was. So we wrote a story about it. What is a facility fee? Where does it come from? Can you avoid it? Do you have to pay it? She came on camera, looked straight in the camera and said, this is not fair. Very interesting story. The woman in the upper right-hand corner was establishing a relationship with a doctor, like a new primary care provider, like you're my doc now. She came out with $650 worth of bills for the initial visit. And then they followed up with a bill for $284 for a blood test that she found out from us she could have gotten for $34 nearby. So she looks into the camera and says, I don't think I want to pay this. The woman in the bottom right, she's actually very interesting, a young person who has a hereditary condition that probably affects her now, certainly will affect her later. So her GP said, well, we should have a baseline MRI. We should just know. And she said, okay, I have good employer-sponsored health insurance. So she scheduled it at Tulane University Medical Center. 2 days before, the hospital called her and said, how are you going to pay for this thing? And she said, well, how much is it going to cost? And they said, how are you going to pay? She said, I heard you say that. I want to know how much it's going to cost. And they said, what's your deductible? She said, $5,000, but what difference does that make? I mean, the price is the price, right? They said, we'll call your insurance company and we'll call you back. They called her back and said, we have really great news. You've spent down part of your deductible, so that MRI is only going to be $4,538. She said, what? So she hung up the phone. She went over, she actually works at the Times-Picayune, which is one of our partners there. She went over to talk to our reporter. So we got to watch this happen in real time. She went to him and said, do I have to pay this? I mean, this is a huge amount of money. And he said, well, look in the database and see if you can find it for a lower price. So she did. She came back and said, I must be doing something wrong. I found the same thing for $672.80. He said, I'm not sure you're doing anything wrong. We see these pricing disparities all the time. She said, what am I supposed to do? So he said, well, check your work, talk to your doctor, make sure that they're, comfortable with you going to the less expensive place. She did actually do all of that. She went to the less expensive place and she wrote us an email explaining that she had decided at the higher price she wasn't going to have this procedure because it was too much money. And when she used our service, our data, she actually had it and had the peace of mind, the knowledge that goes along with being able to afford a procedure. This is a story that we did with CBS News. This was on CBS this morning. Frank is a guy who had back problems. He went to the emergency room and the doctors there told him that he needed to have surgery or else he would be paralyzed. So he said, I'll take the surgery. Went ahead and had the surgery, but after the fact, the insurance company refused to pay, leaving him with $670,000 worth of bills. So he found a billing advocate who helped him argue over these bills. But basically, by the time we talked to him, he still had $220K outstanding. And he'd spent $49K out of his retirement account. We did this story about him explaining that he was stuck with all of these bills. 2 hours later, the governor was on the phone to the CBS brass saying, I think we can fix his bill. And oh, by the way, New York State has a surprise and emergency billing law that doesn't seem to be working in Mr. Esposito's case. So we're going to make some procedural changes, some like legislative or organizational changes that will make sure that people like Frank are protected. So that's the kind of work that we do. These are some of our partnerships. I think there are a couple that are not on here right now. So we partner with these big news organizations to help them do this kind of deep dive investigative reporting, helping their community members understand how to navigate. So in the course of doing this work, we've developed both on our own website and in partnership with others, a series of posts and sort of advice about how actually to navigate. So this is where we get to the point of, I tell you all of our secrets. And I want you to feel free to stop me and ask questions. We'll have plenty of time for questions on the back end, but I'm going to give you an idea of how exactly we tell people to go about avoiding these gotcha bills and how we help people navigate. One of the first things we suggest is that people always ask what stuff costs. It doesn't seem like it's an easy conversation to have. Maybe you won't be asking your doctor every time, but we do think that for things especially easy like MRIs, ultrasounds, that sort of stuff, you can actually ask these questions and find out what will it cost. I'm going to be sending a list afterwards of these blog posts that I'm referring to. I wouldn't expect anybody to memorize this stuff or to know it, from the very beginning, but the next time you have to have an MRI or an ultrasound, you might want to find out the exact name of the procedure, that 5-digit code, and then ask the hospital, the doctor, the lab, whatever, are you in network? How much is this going to cost? How much will it cost me? Then we always suggest that people ask the cash price because we're learning increasingly, as we saw that woman with the ultrasound, like sometimes if you put away your insurance card and pay cash, you get a better deal. It might not fall against your deductible, but if you ask for the cash price, you might be really surprised. We suggest that you call several providers so you have an idea, context and range of options. I did that here actually for an MRI for somebody. The doctor had given us the name of the CPT code, a list of 3 MRI providers that he uses. So, and because we were nearing the end of the deductible year, and because I knew we weren't going to meet our deductible, I figured I would just be a cash customer. Like, I'm not afraid of this. So I called the first place and said, how much is this particular MRI going to be? I'm a cash customer. And she said, you're uninsured? And I said, no, I'm a cash customer and I want to pay cash. And she said, oh, okay. So she puts me on hold, comes back and says, that'll be $900. I said, thank you very much. I called the second place, same question. I'm a cash customer. And she said, you're uninsured? And I said, no, I'm a cash customer. I just want to pay cash. She put me on hold and came back and said, that will be $600. And then I was getting ready to call the third place. And the first place called me back and said, if you can be here at 7 o'clock tonight, it'll be $450. I said, sold. It's like surge pricing on Uber, right? Like if you ask that question, sometimes you'll be really surprised to find out that you can save a ton of money. So this is just this handy little 10-question thing that I will be sending on to you after. We also suggest that the same set of questions should be asked on prescriptions. Maybe putting away your insurance card will actually work. This is our handbook on how to buy prescriptions. It can be a crazy adventure. Like, is it covered? It was $30 last month. This month it's $400. Like, what's up with that? So for every medication you're taking, if you have the time, you can follow these simple steps. Ask the pharmacist, how much is this going to cost me on my insurance? And what is the cash price? We've learned that in many cases, people who have like, let's say your insurance policy has you with a $20 copay for generic drugs. A lot of generics can be bought for like $4 a month. So sometimes those copays are actually more expensive than paying cash. So if you're asking this series of questions, you might be surprised and find that you're saving a ton of money. We usually suggest, again, asking the same question, a chain, a local independent, a big box store. I tend to like Klein Pharmacy here in town. I just like supporting local independents. And they do tend to be right around the same, maybe a little bit less than CVS for the couple of medications that I take. We do hear a lot that Costco has very low prices. And people don't realize that Costco has a pharmacy, or they think that they have to have a Costco membership to use the pharmacy. What we learned when we reported on this a few years ago is that you don't actually have to, or didn't at that time, have to have a membership to use the Costco pharmacy. But if you do have a membership, you get a lower price than people who don't have memberships. So we do suggest that people think about Costco as an option. Sometimes people will try to sell you a discount card or a coupon. You should never assume that that discount card or that coupon is actually giving you a better deal. I mean, it's crazy to think about it, that somebody would be selling you a discount card that actually charges higher prices. But we've seen that happen, and not infrequently. If you don't know about goodrx.com, you might want to think about going there. So for example, it's fairly straightforward. Find the lowest prices. This is a medication that I take. What they proffer to me in the price is, initially they're going to give me the generic, right? You can see here that they've given the generic, and the you can change the dosage if you want to. I tend to use the brand name. So you can pick the brand name. They'll also let you, somewhere here, there's a way that you can narrow it down to your zip code so that you're getting the actual, they've moved it around. It's not the same place that it used to be. Oh, set your location for drug prices near you, right? So in this way, then they're going to tell me, like, is Costco cheaper? Is Klein Pharmacy? Klein Pharmacy doesn't show up on here a lot. And I'm not exactly sure why. I think their business model here at GoodRx is to do business with the big chains and to then get commissions, kickbacks, whatever you call it. Klein never shows up on here. It's always the biggies, right? So these are some of the things that you can do to save money on prescriptions. The other things that you might want to know, sometimes there are patient assistance programs. So depending on the medication and depending on the company, they'll have these patient assistance programs where they'll give you a discount. They're complicated. Some people don't qualify. You can't use them if you're on Medicare, Medicaid, TRICARE, the military insurance policy. But they are an option for many people. And then always, if you find it unaffordable, tell your doctor. I mean, you can ask if there's another medication, or if the doctor can go yell at the insurance company and say, I want her to have this one. I don't want her to have something else. We know that it's not second nature for people to ask questions like this. When you're in the healthcare system, you're not feeling like you want to have a huge discussion about this. You may not be at your best. You may be feeling not well. You may be, worried about getting medication for your mom. It's not the easiest thing to do, but if you can teach yourself to do it and let us help you do it, then we think we can change the system by making it normative behavior. Like, yeah, ask. Like, why not? Why can't you ask? Why can't you insist on an answer? I have a friend who tells this story about how she went to her GP. She needed to have some wax removed from her ear, gross, but whatever. And it's fairly straightforward procedure. She went in and the people at the desk said, give us your credit card. And she was like, well, how much is it going to cost? And they said, well, we don't know. And she said, well, then why would I give you my credit card? And she left because she feels strongly that she should be able to know, particularly for something straightforward like that. When you get comfortable with this, or if you're not comfortable yet, you can look at some of the information on our blog. For example, most of us would not think about haggling over a breast biopsy, but you can save a ton of money. I mean, you use our blog as a resource for thinking about making this a normal conversation to have, realizing that if you save $1,800, I mean, that's a ton of money, right? So if you go to our blog, you can search up here in the search box, search for CT scan. We had a guy come in who was price shopping lithotripsy. He was having his kidney stones busted up. He happened to be uninsured. So there's a lot of information on our website. And if you search up here, you can probably find something that will help you. We also recommend that people check their bills on the back end. I know better than almost anybody how confusing these bills are. They're intentionally designed to confuse you and to be off-putting. I mean, every single one of us has received a paper bill that's like 12 pages of incomprehensible numbers, repeating the same regulatory language in multiple translations. This page intentionally left blank. And we all know when that mail comes, we look at it and we just sort of set it aside. And we're not going to deal with it right now because we're not going to understand it. And it's just going to make us crazy. I've learned how to do this. And I actually kind of crazily enough like reading bills because it's sort of like, it's like a treasure hunt or a puzzle or something like that. So this is a blog post that I'm also going to send you guys a link to. It's called, I call it the Menagerie. It's like a collection of billing practices and patterns that once you see them and recognize them, you can see insurers are paying a lot less than people think they are. And the EOB is designed to perpetuate that confusion. A lot of times the insurer will take instead of the sticker price, they'll make a write down. They'll conflate the write down numbers with what they actually paid. So it makes it look like they're paying more than they really did. The numbers are crazy. Like if you look at this one, for example, the provider charged $498.99. The actual individual is actually responsible for $13.32. Of course, you'd be confused by that. I mean, the idea of these things is to confuse you and to scare you. There are a lot of other ways that, for example, this is where the payment and adjustment are mushed together so that you can't actually see how much the insurance company is paying. What you see is like a whole bunch of big numbers at the top left and then something else at the bottom right. And you're like, I don't understand that, but it's only $40, so I guess I'll pay it. But in truth, a lot of these can actually be deciphered. And well, it's not everybody's idea of fun. If you have the time and the bandwidth to do it, you can find yourself, they're full of mistakes. They're full of mistakes. And because people tend not to read them, I think the hospitals and the insurance companies get away with murder. So treat it like it's a bill for your car repair or for plumbing. I mean, you would question that, right? Don't be shy about challenging or arguing a bill. We have, as in many other things, we have this little handbook for appealing a claim or a bill. Like, how would you go about doing it? Most of us know that if you're going to try to appeal a bill, you have to steel yourself for hours on the phone. You're going to call in, you're going to go through the phone tree, establish your identity with the company, and then you'll be on hold for 40 minutes, and then somebody will pick up and you'll get cut off, right? It's happened to me a million times, either with the hospital or with the insurance company. It's very difficult to actually make these arguments. So most of us have been trained not to argue. I, on the other hand, actually argue a lot of bills because I feel like it's my responsibility and my obligation to hold people's feet to the fire. So here are things to think about. Like, do you really want to do this? I actually have argued a $5 bill before just because it made me mad, but not everybody has the bandwidth or the energy for something like that. Try not to be angry about it. You catch more flies with honey. Get a filing system going. And in every call that you make, take notes, take names, take numbers, get as much in writing as you can. Get the provider's bill first, and then ask things like, what was the diagnosis? Why did you do this? Why am I being billed for all of these things? Some of these never happened. Get the insurer's record. So when you're trying to argue a bill, if you can match the two of them up, I mean, it can be very interesting. And then get your employer involved if it's an employer policy, because the employer is actually the person who's paying the bills, right? So sometimes they can weigh in on your behalf. And then asking these questions, like, I got a bill I don't understand. Why did you charge me for this? I had one of the things that actually set me out on this course of this business was I had an experience at a provider that shall remain unnamed, but whose initials are Lawrence Hospital. And they wound up charging me $1,419 for a drug that I found I could buy online for $2.49. So I argued with him, I yelled at him, I won the argument. But there's stuff like this in every single one of these bills that you get. And I found it very satisfying. I wrote a blog post about it very early in our journey at this company. Follow the appeals process. Sometimes they want you to appeal in writing. Sometimes they want a fax. For heck's sake, who has a fax anymore? But we do suggest that people actually make an appeal if you think that the thing is completely unjustified. And you can maybe make some money on it. So that's most of our work about healthcare pricing. It's like a sort of once over lightly. One of the things that happened to us early in the pandemic was that we realized that for our partners, people care less about the price of an MRI than they do about COVID right now. So we've done a lot of reporting about COVID, where to get tested, how to get tested, who's going to pay for me to get tested, why are the tests so unreliable? And we wrote that story in March. And we're very proud of that. We've been doing a lot of work lately on long COVID, like people who had months and months and months worth of illness. We've also been doing some stuff. Some of you may have seen me writing on Facebook, on MOPS and POPs, about how to get a vaccine, because getting a vaccine has been very challenging. And our partners are interested in that. We're interested in it. So we're doing a lot of COVID reporting right now. If you're interested in those aspects of our coverage, you can take a look at the blog. This is one that we put up just today, about how people are not able to get vaccinated across state lines, about how vaccine sites are being passed on by word of mouth, who gets priority, things about what went wrong with the data system. So you might be able to find some things here that are of interest as far as COVID vaccines, long COVID, things related to coronavirus. And yeah, so that's kind of a once over lightly of our COVID reporting. And I wanted to ask if anybody has any questions for me.
Please put them in chat. You must have questions. Any suggestions on where to get a vaccination?
Well, you know, in that story that I just had up, we have, what we're trying to do in these stories is to, in these blog posts, is to collect experiences of people who have had good and not so good experiences. And then we try towards the bottom of the story to have something that has a what you can do passage. Like, we don't just want to point to the problem and leave you sad and unhappy and anxious about the problem. Not in every case are we able to do this, but we've learned, for example, that while there's been a lot of action on MOPS and POPs, there's some other places on social media that people are going much deeper than what I've been able to do. This is a New Jersey Twitter feed where they are amazingly updating with exactly when these sites open up. Hackensack Meridian drops individual appointments throughout the day. Appointments are full. So St. Joseph's went live 5 hours ago, and 10 minutes later it was full. So there's somebody here on this particular Twitter feed who's watching this topic very, very carefully in the state of New Jersey. In New York, here's one Facebook group. It's taking a long time to load. I'm not quite sure why. So these people are sharing information. You have to join the group. I want to pause for a second and say how crazy I think it is that people should be looking to Facebook or to me for advice on getting a vaccine. I mean, that really should be a government function, I would think. But since government isn't doing very well right now, we're left with Facebook, sort of the equivalent of talking to your neighbors over the back fence. But if you look here, you will see people. So this is February 2nd, so that's kind of old. This one, I have not tried this phone number, but people are sharing information. So this is 22 minutes ago. Somebody's saying, if you call this number, you should be able to get, is it only for NYC? It is only for NYC.
New York State.
Yeah. So the Javits Center had some appointments today on the New York State website. So somebody reported that they have appointments, and then you'll see in the chatter down here, all of a sudden they're gone, right? So they go like that. But if you're watching this Facebook page, you might be able to get some great information. I myself actually managed to get a vaccine because of Maggie Klein. So Maggie and I had been talking about this. I'd been posting stuff on Facebook, and we were having a conversation about it. And Maggie sent me by email. It was on the morning of the 15th, the late morning of the 15th. Somebody had told you that Jacobi Hospital had appointments.
Right.
So I went ahead and called Jacobi. I made an appointment for the following day, the 16th. I'm 66, so I qualify under the over 65. I put it on Facebook the second I called, and like a half hour later, people were telling me that it wasn't working anymore. So all of these suggested spots, like if you hear about this, you need to call immediately, because there are a ton of other people who are trying to do that too. And understanding, I think there were questions about comorbid illnesses and diagnoses. Like, how would you go about proving that? I think the governor addressed that in his press conference today. And here's a person who's talking about other options for proving that maybe if you went to your provider's portal, like your MyChart or whatever, that you could get documentation that has an ICD-10 code. Whether that's enough to qualify you, I don't really know. But there are people here who are asking and answering questions like this. And I do know the governor raised this today in his press conference, although I didn't watch the whole thing. So more information about screening. So these websites are actually, these Facebook pages are actually crazily useful. There's another one that it's called Vaccine Finders, I think. And this Vaccine Finders, Vaccine Hunters, is for people who are looking for leftovers. As you probably know, most of these vaccines, like if they don't use up the entire bottle, then they can, and they have no shows for the appointments, then they can throw it away, but nobody really wants them to. This particular Vaccine Hunter collection of Facebook pages is for people who are trying to systematize way of allowing people to sign up for leftovers. It would not be governed by age or by occupation. It would just be catch as catch can. If you happen to be at a Walgreens and they have 3 doses left, can you get it? And they're trying to figure out how to systematize that. So this Vaccine Finders group, Vaccine Hunters, sorry, is another way of thinking about it. Other questions?
Marvelous, marvelous.
Jeannie, give your email address or your website address, or how people can get more information.
Right. So I'm Jeannie at clearhealthcosts.com. And I will send links to the pages that I mentioned. I guess I can add I'll add a link to some of our COVID coverage too, so you can see what else it is that we have there about COVID. There's a lot of stuff about testing about long COVID. We're very concerned about long COVID, people who had months-long experiences. And the vaccine thing seems to be really hot now. So that's kind of most of what you'll see at the top of the blog. But again, once you go to the blog, if you start searching in the upper right-hand corner, like if you happen to be, God help us, somebody who needs to go, you know, price shopping your breast biopsy, you can just type into the search box up there and see if something comes up.
I received a Good RX card, prescription drug card in the mail. Save 80% on drugs when you present it with your prescription. What do you think of that? Does that work?
Yeah, we've heard mixed reports about whether GoodRx cards actually save money or not. What I usually tell people is that they should look at GoodRx and then also ask the pharmacy, do you accept GoodRx coupons and what's your cash price? Because what we found is that I found in my own personal experience that sometimes they won't accept a GoodRx card and that the cash price that the pharmacy offers is lower. It's a weird paradox because they sell you this discount card or they send you a discount card, but it actually may not give you a discount. So you're kind of left in this sort of, well, I'm not sure. I guess I need to ask. So I would definitely ask.
Thank you.
You're welcome.
More questions?
Getting an appointment for a vaccine is very, very difficult. You can spend hours on the phone. We finally got 2 appointments for my husband and I in Greenwich Hospital, ready for the day. And we get a call, I'm sorry, we do not accept New York residents. End of
Right.
story.
Right.
Same thing happened to me.
Yeah, that's in this story. It happened, I think it was last Thursday, that the New York Times ran a story about people who were crossing state lines for vaccines, and instantly everybody shut that down.
Yeah.
I think it's a function of the way the previous administration devised this sort of state by state allocations. So that Connecticut is keeping all of its vaccines for Connecticut people, New York is keeping, and it's just another example of how screwed up this entire process has been.
Yes.
People are dying as a result of poor planning or lapse of duty on behalf of the previous administration. We're doing the best we can to help. I do suggest that, crazily enough, going on these Facebook pages that we mentioned, I mean, that is a solution. I know that the earlier postings that we did on vaccine on MOPS and POPs, I know dozens of people who found vaccines that way, but I don't have as many sources of information as the sort of crowdsourcing that you see here on these very effective Facebook pages. We tried to check everything that we post on our website. You'll find that some of the stuff on these Facebook pages is not really checked that well. However, people will chime in and say, well, that doesn't work anymore. Or I urge you to look at both the Vaccine Hunters and the other Facebook page that I mentioned, because they're truly very effective. Again, the equivalent of yelling at your neighbors across the back fence, but it works. I mean, it works. It works, and we're all in it together. And thank you, Maggie, for getting me towards Jacobi Hospital.
Has anybody heard about CVS yet?
I've been there. I've been to 3 different CVSs, and they will hand you a little paper which gives you the website of where you should call in New York State. They have no list. I thought maybe I could get on a waiting list or something, but no such luck.
So as I understand it, and I believe that's in that blog post that I mentioned, the CVS in Manorville.
Yes, Manorville, out near the end of Long Island, Montauk. It's near Montauk.
Right. This place just swam up. Like, I don't have any idea whether this one is legit or not, but this swam up in one of the Facebook pages that I was looking at. And they seem to be having vaccines. I mean, I don't know because I can't check out all of them.
Yes.
But I think that the best way to approach it is to, find 3 or 4 places that you're going to watch. Javits wound up with appointments this afternoon. Like, who knew? That I found out about on one of these Facebook pages. People were like, oh, there are Javits appointments. And then boom, like 15 minutes later, people were saying, no, not anymore. It does seem to me that the tension is letting up a little bit because there are people who have already managed to get vaccines. But I would suggest that these two, this vaccine help and then the vaccine finders
Okay.
would be really good places to look. What else? Any other questions?
What you
Well,
do.
thank you very much. You've been very excellent and helpful.
Well, thank you.
Hopeful, yes. Oh,
Yes.
God.
Thank you.
We do thank you.
Yes, thank you so much.
Thank you very much.
Sure. Thank you.
And
And Maggie, if I send you a list of those links, will you make sure that everybody gets a copy of that?
I'll do that.
Oh,
Okay.
I would love
Alright.
that. Thank you.
Wonderful.
Thank you.
Okay. Thank you so much.
Thank
Mm.
you.
Thank you. Thank you. Bye-bye.
Thank you. Bye-bye.
Many
Bye-bye.
thanks.
Mhm.